Hello and welcome to the final episode of our podcast for this year. As we wrap up 2023, we want to thank you for all your support and feedback throughout our journey. As we put a bow and wrap on the year, we wanted to let you know that you're the reason we do what we do, and we're so grateful for your loyalty and enthusiasm. We hope you enjoyed listening to our podcast as much as we enjoyed creating it. We love hearing from you, and in this episode, we'll cover a few of the listeners' questions. The first of those questions is, I wonder about a discussion on approaches to enable beneficial exercise practices in osteoarthritis patients, and which might come first, weight reduction or exercise? Or are there means to do both effectively? Great questions, and as always, the answer is not straightforward. So, as you know, many different people might have different needs and preferences. However, there are some general guidelines that most people can follow who have osteoarthritis to make the best decision for their health and well-being. First, it's important to consult with a health professional before starting any weight loss or exercise program, as they can assess the severity of your osteoarthritis, recommend the most suitable type and intensity of exercise, and monitor the progress and outcomes. Now, there are lots of health professionals, particularly who have exercise in both exercise and diet. And I guess just to mention a few here would be physical therapists, exercise physiologists, dietitians, nutritionists. But I would hope that they should also have one really important quality, and that's that they hopefully motivate you to continue and monitor your progress, adjust accordingly, but in particular for exercise and for diet, do something that you enjoy, that you're going to be able to maintain longer term. Second, when you start a program like this, it's advisable to start slowly and gradually increase the duration and frequency of exercise, as well as the amount and quality of food intake. That can help you to prevent injuries, overexertion, and frustration that may lead you to quitting from the program. It's beneficial to combine both aerobic and resistance exercises, as they can have complementary effects on your joints and overall health. Aerobic exercises are things like walking, cycling, swimming, and they can help you to burn calories, but also improve your overall cardiovascular fitness. Resistance exercises, such as lifting weights or using a TheraBand or elastic bands, can help you build muscle mass. Fourth, it's really important you be listening to your body and adjusting your weight loss goals and exercise plan according to what your body's telling you and according to advice from your healthcare professional. In general, if I'm going to answer this question, a combination of both diet and exercise is best. If you look at some of the pivotal trials in this space, particularly a trial like the IDEA trial from Wake Forest, we found the combination of exercise and diet was better than either of those on their own. So I would strongly argue, if you can, pursue the combination. It's important to recognize that both weight loss and exercise are important aspects of osteoarthritis management, and they can have positive effects on both your joints and your overall health. But it's important similarly to recognize that no one size fits all, and you might need to know from a health professional what's going to suit you best, and ultimately you probably have a pretty good idea yourself. Another question was really about the role of alcohol in osteoarthritis. And as we draw towards the close of the year, this is probably a really pertinent, relevant question for many of us to answer. The role of alcohol in osteoarthritis is not particularly clear-cut. Now, some studies have suggested that moderate alcohol consumption might have an anti-inflammatory and protective effects on the joints and reduce the risk of or severity of osteoarthritis. And that is probably particularly as it relates to the component of red wine called resveratrol, which may have antioxidant effects. But similarly, it's important to recognize that there are probably as many studies that have found no association or even a negative effect of alcohol on osteoarthritis, particularly for people that have got osteoarthritis affecting the spine and or the knees. It's also important to recognize that alcohol might interact with some of the medications you might be using for pain relief, in particular anti-inflammatories or paracetamol, and increase the risk of you either sustaining damage to your liver or bleeding from a stomach ulcer. Now, the recommended amount of alcohol pretty much for everybody, including those people that have osteoarthritis, is no more than 1 standard drink per day. So that's equivalent to 1 regular beer, 1 glass of wine, or 1 shot of spirits. It's similarly really important to recognize, particularly for those of you who are pursuing weight loss goals, that alcohol may have empty calories. So if you're trying to lose weight, the alcohol will oftentimes not likely be your friend. Another question is, I'm a sufferer of osteoarthritis and would love to listen to a show on the topic of what DMODs, or disease-modifying osteoarthritis drugs, are in phase 3 and what the likelihood of them coming to market is. So firstly, DMODs, or disease-modifying osteoarthritis drugs, are a class of drugs that aim to slow down or reverse the progression of osteoarthritis by targeting different aspects of the disease, such as loss or damage of cartilage, bone remodeling, or inflammation in the joint. Currently, there are no DMODs that have been approved for human use, but several candidates are undergoing what we call phase 3 clinical trials, which is the last phase of clinical development before a company might seek approval for the use of that drug by the regulators, and then that can subsequently be hopefully commercialized if it's positive. Now, it's really exciting news to let you know that 2 drugs are currently in phase 3 therapeutic development. That's Colon Tissue Genes Invosa product and also BioSplice Therapeutics Loracetavir product. Now, these are both intra-articular injections that modulate the joint's repair and physiologic processes in an effort to either retard the progression or reverse the progression of the disease. Both of them have been tested in patients with moderate to severe osteoarthritis, and at least in earlier phase trials have shown promising results in improving pain, function, and in joint structure. If those phase 3 trials are successful, they would likely become the first disease-modifying osteoarthritis drugs to reach the market, and hopefully for people who are out there, provide a new option for osteoarthritis management. Now, in closing, I think for everybody who's listening, they all know that osteoarthritis can have a negative impact on their quality of life and their ability to perform activities of daily living. Believe me, as someone who not only researches, treats, and speaks about osteoarthritis, but has lived with this disease for years, I know that being proactive about managing the disease can make a massive difference. Now, particularly during the holiday period, it's important to be mindful and aware of some of the ways that you can manage your osteoarthritis and stay healthy, mindful, strong, and at a healthy weight. So be mindful about eating a balanced diet, exercising regularly, and where you need to, seek professional help. It's not a condition that you should need to deal with on your own. There are many different ways health professionals can help you manage your symptoms and improve your well-being. So to close, I'd really like to thank you all for your support of the podcast, particularly to Vicky for her enduring support and help to make the podcast a reality. And we are both really looking forward to some new innovations next year that we hope you will enjoy. We wish you all a very happy Christmas, happy holidays, happy New Year, and I hope you have a wonderful time with your loved ones, and hope the new year brings you joy, peace, and prosperity. We look forward to reconnecting with you in 2024 with some more exciting and informative episodes. But until then, stay safe, and please do take care of yourself, and if you can, someone else as well.
Thank Thanks for listening to Joint Action with David Hunter. If you like our show and want to know more, visit www.jointaction.info. If you have any questions, you can email us at hello@jointaction.info and follow us on Twitter @jointactionorg. This podcast was hosted by David Hunter, edited by Vicky Duong, music produced by Jordan Hunter. The information posted on this podcast is not intended to diagnose, treat, cure, or prevent disease. Anyone seeking medical advice should consult a health professional.